Now, I'll talk about one more topic, that is, does RT-PCR test coming negative or rapid COVID-19 antigen test coming negative, does it really mean that you don't have COVID? I'll be talking on this topic. See, the most important thing is these tests like RT-PCR, that is reverse transcriptase polymerase chain reaction, is a very, very sensitive test. And it usually takes around 24 hours for the detection of this COVID-19. And this test can definitely come negative even if the patient has COVID-19 infection. Not only this, but this rapid antigen for COVID-19 test can definitely come negative in initial stages of the COVID-19 disease. So if the virus in the body is multiplying like from thousands to 10,000 to million to crores and to, so the virus is still multiplying, so this viral load is not that much high to get detected, so the virus may or may not get detected. So it is very, very easy for us. So if someone gets diagnosed with RT-PCR positive or rapid antigen positive, we can treat them accordingly. We can give them antiviral medicine, that is favipiravir or remdesivir, or we can also give the steroids, which is the one of the most important treatment for COVID-19. But if this test like RT-PCR test or a rapid antigen test they come negative, it is not necessary, it is not mandatory that patient doesn't have COVID-19. In this scenario, if the patient still has symptom, we can go for CT scan of the chest. CT scan of the chest is very, very important diagnostic modality from which the corona can be seen very easily. See, in HRCT chest, which if it is done after like 5 to 6 days of the symptoms, because in the initial days of the COVID-19 symptom, like from first 5 to 7 days, CT scan may not show that much typical symptoms or typical signs of COVID-19. But when it is done on 6th or 7th day, it can show very, very typical classical changes of the COVID-19, which are a peripheral, subpleural, ground glass changes. So these are very, very highly suggestive of COVID-19. And there is one system called CORAD system. So CORAD, we have like CORAD 1, CORAD 2, CORAD 3, CORAD 4, CORAD 5, and CORAD 6. CORAD 6 means it is almost 100% sure that it is COVID-19. CORAD 5, it means it is very, very highly likely that it is COVID only, and any other disease is very, very, very unlikely. CORAD 4 means it is like more very highly likely to be COVID, but other diseases can also be there. And CORAD 3, 2, and CORAD 1, it means that the COVID-19 is less likely, and maybe the other symptoms or other diseases are more likely. So in such patients who are RT-PCR negative, a rapid antigen negative, but if the CT scan is showing it is core at 5 or 6, or if your doctor is saying okay, this is 100% COVID, you should trust your doctor, and that is a sign of COVID-19, and you should simply follow your doctor's advice. And in that scenario, whether your RT-PCR is negative or your rapid antigen is negative, you should stay strictly quarantined at least for 10 to 14 days from the first symptom, because the patients who are less than 35 years of age usually have very, very mild symptoms, but they are very highly infective. They can infect their elderly parents, those patients who have a father, mother, grandmother, grandfather. So if you're having fever, cold, body pain, weakness, tiredness, throat pain, throat irritation, these symptoms, if you do RT-PCR test or rapid antigen test, it comes negative, don't ignore it. You still need to remain quarantined for at least 10 to 14 days strictly, because you may be very young, you may not have very much symptoms, but you are very highly infective and you can spread the infection to other people, especially your mothers and father, and they may suffer a lot. So in that scenario, if it is highly susceptible, if you still suspect it, you can simply repeat the test maybe after 5 days. The chances of getting that test positive significantly increase if you do the test after 5 days. Thank you.